Candida auris, or C. auris, causing concern in long-term healthcare facility settings.
The incidence of infections has exploded almost 200% or more.
Not a new fungus, but one on the rise over the past couple years.
It's a fungus that is going around. It is spread through person-to-person contact. And it is something that's actually been around in the United States since 2016.
Most concerning to healthcare professionals is how stubborn C. auris is to treat. Doctors consider it a multi-drug resistant yeast.
Anytime we start to see bacteria or fungus or virus or anything spread that has that ability to fight off our usual tools that we use to kill it, that sends up alarm bells and really makes us pay attention.
And infection with C. auris can be so invasive, the Centers for Disease Control and Prevention says it can have up to a 60% death rate among patients already in the hospital who contract it.
Someone comes in with gloves, and what do? They flip on the light, they touch the doorknob, they move the bed tray, they touch the curtain, and then they want to touch you.
That's why patient safety advocate Marian Hollingsworth says it's okay to speak up and ask your provider to wash hands an extra time or put on new gloves when entering a room to treat your loved one, and ask about whether the facility where they're being cared for is dealing with a C. auris outbreak.
If your grandmother, spouse, loved one is in a nursing home, don't be afraid to say, "What are you doing to protect my loved one? What are your procedures?"
Dr. Vanessa Walker agrees it's okay to ask and advocate for your family members. And she also shares right now the risk is extremely low for anyone outside the long-term healthcare setting to contract C. auris.
We've been concerned and scared for the past 3 years about so many different things. I don't think that this is one of those things. It's just something for those of us taking care of patients to really look out for and to be vigilant about.
Melanie Wingo, KCRA 3 News.
And it's important to note the CDC says C. auris is not a threat to healthy people. Doctors may test their acutely ill patients for the fungus if they start seeing prolonged fever, elevation of white blood cell counts, or signs of sepsis, the body's extreme response to infection.